we were looking at, as I said, at the hypothalamic pituitary axis and also at the sympathetic nervous system, actually via the autonomic nervous system. And we were measuring cortisol, and I'll show you data, and we also measured by proxy levels of the autonomic nervous system. So how did we do that? We know that there are allostatic system changes during pregnancy, so we knew that we should expect to see an increase in the HPA axis levels and also differences in the autonomic nervous system tone. In the literature, we found that stress and negative changes in mood during pregnancy are associated with elevated levels of these factors, and also that fetal cortisol levels were linearly related to maternal levels. And I will show you directly results from our moms and babies. So the idea is that if the HPA axis and the ANS activation are off, it may disrupt the fetal environment. And as I said, pregnancy is associated with a whole list of ANS changes. One way of measuring it, and I'll show you data on that, is to actually measure heart rate variability. And we already knew that reduced heart rate variability was found in pregnant women with abnormal uterine perfusion and with pregnancy-induced hypertension, but nobody has actually looked whether that has anything to do with stress, anxiety, and depression. So the aim of this first part of the study was to examine the influence of what's happening to the mom. And the hypothesis was that depression during pregnancy will predict increases in infants' ANS and HPA axis reactivity as measured using heart rate variability and also salivary alpha amylase. And I will explain in a minute why we actually measured alpha amylase. The treatment also, we suggested, would buffer the negative effects of maternal depression. So this is just a summary of this very preliminary data set on the first moms that were in that study. 46 were in the depressed group and 38 were in the control group. Of the 46 depressed, 21 were taking antidepressants, and I'll show you some data on that. So the women were seen in the second trimester and in the third trimester, and this is when they had the HRV done, the heart rate variability, 24 hours EEG and EKG done, and then the birth outcomes, and then after the babies were born, we also did heart rate variability on the babies, and we repeated the measurements of saliva. This is just to impress upon you what heart rate variability is, which maybe some of you are not familiar with. Actually, you measure the mediated changes in cardiac autonomic function, and it provides an indication of stress vulnerability. And what you measure is the RR interval that is used to calculate HRV measures. And there was some indication in the literature that it is decreased in depression and anxiety, and we were wondering whether that will also hold true in our pregnant and postpartum population. The strange thing about salivary alpha amylase is that it is a digestive enzyme that you have in your saliva. It is secreted by the acinar cells, and it is increased when you have psychosocial stress. So here is just an example. These are the levels when you stress a person, and this is what happens during rest. And the proof that it actually measures the autonomic nervous system activation is that here you have amylase in response to stress when you give a placebo, and here you have amylase when you block that response with a beta-adrenergic receptor. So this is a direct pharmacological evidence that salivary amylase is a nice reflection of the autonomic nervous system. So the first thing we did, actually, we measured cortisol awakening response. Cortisol awakening response is probably currently the best way to measure stress response, which is a non-invasive thing. You actually ask people to take home tubes to collect saliva when they wake up, and they have to take samples at 0, at 30, at 60, and 90 minutes after they wake up. And the area under the curve and the response, as well as the baseline, each of those measures give you an indication of the stress response. So, for instance, here you see that we have a nice correlation between the changes, or the area under the curve, and the depression scores in this population. What is probably more interesting is that when you look at the cortisol early awakening response and early life trauma, which we measure by a questionnaire which is called the Childhood Trauma Questionnaire, it's very interesting that you see a nice correlation between the baseline responses in cortisol to the levels on the CTQ. It actually reminds us of some of the data that you will find in the literature on lower court levels and responses in patients with PTSD. Again, here you see a population that comes to you for no other reason other than being stressed, anxious, and depressed during pregnancy. But one of the nicest correlations that you see is actually with their past history. And here comes the cross or transgenerational stuff that we find so interesting. So when you look at maternal prenatal cortisol levels, they're directly related to the infant cortisol levels at 3 months of age. And here you have the whole group of that pilot. This is a total of 67 mothers. So you have the infant baseline log transformed and a maternal baseline log transformed, and you see the very nice correlation with an R factor of 0.31. The same population, and this time we already have more than the 67 dyads. We have 128 dyads now. Correlation, this is hot off the press. We actually did the analysis on my way to the airport. Correlation between maternal and infant cortisol at 3 months postpartum. So now you have both the mother and the baby at 3 months. And again, the correlations are really impressive in this way, even more so. They're positively correlated. The higher the cortisol in the mom, the higher the cortisol in the baby. What about the heart rate variability? One of the measures of heart rate variability is to look at low frequency and high frequency, which actually gives you the balance between the sympathetic and the parasympathetic systems. And if these two systems are not in balance, that's actually not a good sign in terms of the reserve. Heart rate variability, the higher the heart rate variability is, the better your response to stress is. If you have a very low heart rate variability, that means that you don't have much of a reserve to respond to stress. And I'm talking about physiological response, not psychological response. And here you see the first time that actually you have a correlation between the physiological response, which is the LF-HF ratio, and the Edinburgh postnatal depression score, okay? This is during pregnancy in those moms. This is an N of 78. Now, what happens when you measure actually 24-hour HRV during the 3rd trimester? And I think that before I will tell you what you see, okay, I will tell you that you and we are under barrage, okay, of not subscribing antidepressants to pregnant women, and every Monday or Thursday you see something in the media that something terrible has happened because somebody has prescribed an SSRI or an SNRI to a mother who was pregnant. Well, I want you to look at this carefully, okay? In this slide, we're looking at another measure of HRV, okay? The SDNN is the standard deviation of all normal RR intervals, okay? And the more deviations you have, the worse the HRV is. So what you see here is that actually This is the depressed group. We have 26 moms here, okay? These are the controls, 35. This is a normal range. And these are 20 out of the 21 depressed women during pregnancy that were prescribed an antidepressant, okay? So depressed group on no antidepressants is the one group that is significantly different from the controls. Whereas depressed moms who were taking an antidepressant, their heart rate variability goes back to be normal, to be almost the same as controls. And you will see that much the same thing happens with the babies that are born to these moms. Again, we're looking at the LFHF ratio, okay? And this is now the reverse from the SDNN, okay? So this is not good because they're in imbalance. This is the depressed moms who are not taking medication. These are the controls. This is a normal ratio. And these are the babies that were born to depressed moms at 6 weeks of age. Their HRV is the same as of the controls. And again, this is highly significant. In all these cases, we had to control both for the sex of the child and also for maternal smoking. And I'll tell you a little bit more in a bit about smoking. So to summarize this part of my talk, depressed women during the third trimester of pregnancy and their 6-week-old infants showed decreased HRV, suggesting that there is a decreased parasympathetic or increased sympathetic influence on the autonomic nervous system. Antidepressants seem to buffer some of the pathophysiology that we see in maternal depression. And it actually buffers it both for the moms and for the babies. This is now going back to the alpha amylase, which is another measure of the same autonomic nervous system. And again, you see that we have very nice correlations between alpha amylase in the babies and alpha amylase in the moms. Here we divided it into the 3 groups, and you see that the best correlation actually is in the group of the moms that were depressed, stressed, and anxious. I have to tell you that when we did that, we were told that you cannot measure alpha amylase in children under the age of 1. And we actually proved them wrong, because you can measure alpha amylase at 3 months of life. And just to impress you that there was another study going on at the same time, not by us, that looked at infant alpha amylase, and they actually did a stress response to alpha amylase, again looking at 2 months, 6 months, and on, and compared also these first 24 months in the children to the maternal level. This is the maternal level, and this is the dispersion amongst the babies. And this is our own data with the sampling time, and you can see that in our hands, the maternal levels are actually almost an image mirror of what was done by a similar group in 2009. And also the levels that we found in our babies are very much the same. And there is a fantastic correlation statistically between the levels in each mother and her child. So we think that these are significantly correlated even when you control for feeding during startle test protocol and maternal antidepressant use. So maternal ANS during pregnancy may program the ANS of the infant, and that can happen in utero. And I think that the message is that we should not just rely on psychological measures. I mean, the psychological measures are extremely important, but if we can add some physiological non-invasive measures, and I'm talking about non-invasive, we are collecting saliva. This is not an invasive method. Oops, sorry. So, just to mention a little bit of the genetic work that we are doing, and again, the background is the serotonergic system, looking at the polymorphism in the promoter region of the 5-HTT gene. You know from the literature, Hariri and Caspi have published it in the early 2000s, that individuals with 1 or 2 copies of the short allele have more intense reactions to stimuli, have more depressive symptoms, and some of it is related to a history of stressful